Hello. Okay, we're just welcome everybody. We're just opening up the webinar now to check everybody can hear us and do a bit of a sound check. If you're here and you're listening, it'd be great if you could just in the chat box say, yes, I can hear you okay, or no, I can't hear you. I can just see pictures of myself and Viv. So let us know if you're here. It'd be great to hear, and also where you're from, where you're coming in. Okay, thanks, Terry. Yeah, you can hear. That's great. Please let us know where you are as well. Where in the world you are. I know we've got people dialing in from all over the world today, which is so it's early morning for the US. Okay, David. Okay, so David can hear, but we aren't doing actual visual recording of us today. So you should just be able to see a placeholder with myself and Viv and our kind of bios. Okay, thanks, Elizabeth, coming from London, and David's in Leeds. Just checking here. You can see the screen. Yeah. Okay. Okay. Thanks, Carrie. You can hear coming from Medway. So yeah, delighted to have everyone here. We will start at past because obviously I don't want anybody to miss anything. But we're very excited. This is Step Jockey's first webinar of a planned series. So we've got some more in the pipeline, especially around the kind of property wellbeing side. We've had a fantastic response to this webinar. And there's a lot of people that I know have requested the recordings afterwards, which we will be sending out. Okay, thanks, Joe, coming from Birmingham. Great, glad you can hear us. We are here in Step Jockey's office, which is in Soho in London, based at the top of a 4-story tower, because who would we be if we didn't have stairs? So we'll just wait for a few more people to join. Okay. Very, very exciting. And okay, I think we've even got, yeah. We've even got people dialing in from Thailand. Okay, thanks, Justine. Can hear you from London. Oh, we've got someone from the Philippines as well. Thank you, Catherine. Nice to have you. We'll be starting in just a minute. I'll just wait for a few more people. Just to let you all know, this will last 30 minutes. So you can manage your time, grab your lunch if you're here in the UK. Hopefully it's healthy. Okay, right. Well, we'll get started now. And obviously, as others join, they can join in. So welcome, everybody. My name's Laura. I'm Step Jockey's workplace health specialist, and I'm going to be hosting today. It's a very exciting first webinar that we're running. A bit of housekeeping before we start. So it will last 30 minutes, and by all means, we really want to capture your questions. So please type in any questions you have during the webinar. We may, due to the time, not be able to answer them all at the end. We're going to see how we go, but we will endeavour to write up answers to kind of some of the top main questions and send them out afterwards along with the recording. So please, if you do have questions or queries, write them either in the chat or the questions, and we will look to address them. So a bit of a quick introduction to myself. I've been working with Step Jockey on implementing their stair climbing programs for various clients, property clients all over the world. And that includes single occupancy clients and multiple tenancy clients, of which I've got experience with. I've personally am a former certified health coach, so I have helped people change their health habits and know how hard that is. and I've got background working in the IBM real estate area. So it's really nice to see everything kind of come together. I'm very excited. So it's been sat here silently, but I'm very excited to introduce Dr. Vivek Muthu. So Viv is a renowned health and life sciences consultant with a real understanding of healthcare market dynamics, policy systems, and really what's in the future, what's in store for the healthcare ecosystem. He trained as a doctor at Oxford and Cambridge, gaining a first-class degree in medicine and surgery. And he was the former global managing director of healthcare of the Economist Intelligence Unit, where he's still now a trusted advisor and still involved, along with all the other work he's doing with public sector, NGOs and industry. So we're enormously privileged to have him here today with such a powerful understanding of health, and what the implications are of the built environment. So welcome, Viv. Welcome.
Thank you, Laura, and thanks to everyone who's joining from, including Canada now as well as other far-flung parts of the world, and lots from the UK as well. So yeah, Laura, thanks for that. I obviously come at this. I'm not an expert in buildings or facilities management. I come at this very much from a health policy and health systems background. And I think, it's very easy. One sees things happening in health and healthcare, which is very easy to put down to sort of faddishness and to fads. So, an interest in wellness and an interest in physical activity. Is it a fad? Is it something, a flash in the pan? And I would say definitely from a health systems perspective, it is not. This is a trend that is real and here to stay and will only increase in intensity and in the degree of kind of compulsion behind it, mandate behind it. And again, looking at this from a health systems perspective, there's several things driving this. And it should come as no surprise, I suppose, many of these things. When we look at the politics that drives us in all of the countries that we've come from, it's often around healthcare. Healthcare makes and breaks elections, and it makes and breaks things like the EU referendum was often about. The discussion was about the NHS. And central to all of that is what I call a cost quality crunch. We're always talking about the cost of healthcare, and it really is a problem that is not going away, and it has implications for what for Step Jockey and for the kind of people you work with. There's several trends that we've done actually so well with our societies and with our healthcare that actually we now have aging populations, these inverted population pyramids, and fewer number of young people, but a growing aging populations. That in itself isn't an issue, except when you consider those aging populations are now suffering from long-standing chronic diseases, and often multiple chronic diseases. Coupled with that, a sort of infinitely growing demand and expectation of what healthcare should deliver. And on top of that, the fourth factor is what we call healthcare price inflation, which is that the cost of the technologies and the services that we have in healthcare, those costs rise above the rate of inflation. Now, all of this sort of comes together to drive healthcare costs consistently above GDP growth. Yeah. Which means that, and this is work that's been done by the likes of the OECD and WHO and others, that as a percentage of GDP, without reform, some countries are facing, between a doubling, most countries are facing between a doubling and a tripling, if we don't reform our health systems, of healthcare expenditure as a percentage of GDP in the next 40 years. Might seem like a long time, but actually that starts to kick in. And what we see, all these crises in the NHS and the cost of Medicare and Medicaid in the US, all those discussions actually come down to these same factors.
So this is just so interesting. It really sets the scene, and because I'm conscious of the audience with the property, so I'd love to know why you then think that's going to transfer into the built environment, and why this health crisis is powerful. It's going to have an impact.
So our traditional way we built our health systems was in terms of bricks and mortar hospitals to deal with acute diseases that we could fix and send you out. And that's the central problem with our health systems at the moment, is that they're all about sick care, not healthcare. They're not about keeping us well, which is now the priority in the 21st century. They're all about fixing us when we're broken. Mm-hmm. And that's the problem. And so somehow the emphasis needs to shift now from sick care to keeping us well, and to preventing and mitigating the chronic diseases like diabetes, like cardiovascular disease that we suffer from. So there's got to be a shift onto prevention. Yeah. Typically, prevention is a tiny sliver of healthcare expenditure, and politically it's very difficult because there's an opportunity cost with everything that we do in healthcare. It's not politically acceptable to raise taxes to boost healthcare expenditure to a higher level, substantially. So when we say we're going to invest in something like a treatment in healthcare, that means we're denying something else that we could be investing in healthcare. So when you say, I want to invest in prevention heavily in healthcare, that means I'm going to take away cancer treatments, I'm going to take away, that's the trade-off that has to be made. And that is politically unacceptable. So what do you do if you want to encourage prevention? The onus shifts then onto things outside the traditional healthcare sector. And that's where the custodians of our built environments, the custodians actually of the risk factors that expose us. So the food and drink industry is also going to be exposed to this, and we see increasing regulation there, mm-hmm. Sugar taxes and the like. The same thing we can expect will happen with the other risk factors like sedentary behavior, which is a really novel phenomenon. If you go back 20, imagine how many emails you send today. Yeah. If you had to get up and talk to those people, yeah. How much walking would you do? So we are in an evolutionary, if you like, evolutionary unprecedented and rapid different environment. Yeah. And it's happened over the course of 2 decades. And that is something that we really, really need to address. So that's where that's why I think this is not a fad. This is actually going to be a growing concern. And I think what are now voluntary regulations will become mandatory regulations. And of course, there are economic drivers as well. We know that mental health is improved through better physical activity. We know that productivity is improved. We know that in this global war for talent, mm-hmm. That keeping people happy and healthy, employees happy and healthy, is part of what attracts a very mobile and versatile workforce. So, for all those, those are outside of health systems, but you've got these health system reasons, then you've got these economic reasons why push and pull factors, if you like, yeah. Why it's important. Yeah, absolutely. And
obviously we see here that push from, say, tenants and employees to want to be able to have environments that stimulate them to do more movement. But it's so interesting, this bigger picture of the impact essentially on our economy because of the healthcare crisis, and how this has got to shift towards prevention, and especially around the sedentary lifestyle. So obviously you've got lots of people now that are sat in buildings, not moving very much. And that's the problem. They're able to send emails, not moving their computers. They're able to message everybody. They're even have meetings all over the world now because of technology. How does sedentary behavior, I guess, compare to other health things like smoking and diet, and how significant is that now in terms of chronic disease?
Well, I mean, I think it is as a single risk factor. It's clearly less critical than smoking, but that's not to say that it's not important. For one thing, we are dealing with smoking in various ways, and it's not an either or. We have to deal with smoking, and that is clearly the biggest risk factor for many of these diseases. But we have made substantial inroads in that regard, and incidentally, all those inroads have been made through mandatory regulations that have changed our cultural norms but are also legally enforced. And we can expect the same to happen with these other risk factors now that we've knocked off or are substantially impacting the first one. So when we look at sedentary behavior, first of all, I don't know that we actually know the broader impact, because as I say, the degree of lack of physical activity that we now experience is unprecedented. So it will take time to develop the evidence base for this. We know that certainly it is in itself a risk factor, but there's a dose response curve to this, and the dose of sedentariness, if you like, that we are receiving now is massive. And so we don't, the evidence is yet to emerge about what those effects can be, but we know we can impact it. So I think, that's the point, is that it's something that can be impacted. We know how to impact it, and we know that it has substantial health risks. Yeah. And we know that we cannot afford to carry on with our current mechanisms of fixing things only when they're broken.
Yeah. So where you say, things like that are voluntary, that are now going to become mandatory, do you think things potentially like the WELL and the FitWel standards, which are two things that are gaining in popularity around building well-being, are two examples of something like that might happen?
Yeah, it would seem like, that's the kind of thing. I mean, where, you've had, again, using the food and drinks industry as a comparison, or using smoking as a comparison, you have voluntary standards at first, then you have legislation that comes in place, say, with cigarettes, it was around advertising. Now you can't even reveal where you're selling them and you can't smoke indoors. So, and the same with the food and drinks industry, we've had voluntary standards, sort of economic and consumer pressure put onto food and drinks industry in certain cases, and now we've got tight standards on nutritional information, sugar taxes in some countries, etc., etc. So yes, all these measures will likely come into our built environment, which is an exposure. It's a risk factor. It's a setting where we're exposed to risk, where we know what the risks are and we know how to mitigate them. We know there are ways we can mitigate them. So it is a matter of time.
Yeah. It's very interesting. Obviously, I come from having implemented many stair climbing programs and visiting many buildings with staircases. It's amazing that staircases, traditionally, a lot of them have been hidden. So whereas now we're moving towards developments like the Bloomberg building and things, where stairs have become like a real prominent feature in the building, in the design period, because they know, okay, we want to get everybody using the stair. They need to be a central feature rather than hidden behind an invisible door.
Well, yeah, I mean, it brings an interesting general point, which is around we've known about lifestyle risk factors for a long time. What has traditionally, and until recent years, where the evidence base was poor, is how to make a difference to those. So, an advertising campaign that you should walk more is not terribly successful. But making the healthy thing to do, the easy and attractive thing to do, is really the thing that moves the needle on this.
Yeah.
And so, things like putting healthy foods at the right level, where at eye level on the shelves. Putting staircases where you can obviously see them, making them attractive places to be, rather than dank, horrible, where you don't know if you're going to be mugged as you walk down them, that kind of thing, or you don't even know where they are because they're hidden away. That kind of thing makes a difference. The other thing we know makes a difference is personalized intervention. So not generic messaging, but messaging that is tailored towards you, that hits you at the right time of day. And so there are these behavioral economics, in which I'm not a great expert, but we do know that these nudge and behavioral economic techniques seem to have a greater impact on these lifestyle choices that we have.
No, they're very powerful. I mean, we had one client actually that, in terms of making a stairwell not as dingy and dark, they actually put motivational quotes on the stairs. They theme the whole staircase around Everest. They serve Nepalese food, so very creative ways of just making these spaces a bit more engaging and encouraging that movement, which brings a bit.
That's very interesting.
Which was it was one of the most creative things I've seen. I was really impressed with them. Be really interested. Obviously, we've started talking about a few things that people can do, but I want to just move the discussion on to other things that, say, if there's building managers or those that are taking ownership of property who want to go, okay, we want to help, we want to be part of this. We want to, move towards the kind of societal impact of improving the health of those using our buildings. I guess, and I know this isn't probably your main expertise, but what ideas and what things, and I'd open it up to the audience as well, what things do you think can be having an impact in this area? So we've talked a bit about the stairs.
Yeah.
Are there other things within buildings that can be done?
Yeah, sure. I mean, I think one of the key sort of phrases here that's relevant is incidental exercise.
Yeah.
So it's in the course of one's daily work that one exercises, that you move around. So as I said, this sending of emails, it's very easy to do. You sit at your desk, it's very easy to sit there for ages. Actually, there are wider benefits of getting up and speaking to someone. You get nuance and interaction that you wouldn't get. It is easier to understand. Everyone's had that experience of sending emails and it being misunderstood and causing who knows what fallout. So I think this idea of trying to encourage movement, through standing up, I've been to buildings where there are no rooms to sit down for meetings. You actually stand up. I think it was Bloomberg, but I think it was Bloomberg in London, where you only had stand-up meeting rooms, and so it keeps the meeting short and to the point, and B, it just keeps you on your feet, and we know that actually improves productivity. It improves people's cognitive abilities. If you're moving around, you tend to be more creative. There's evidence for all of these things. So I think it's this idea that whenever and wherever possible. Let's not just say sat down. Let's try and get even a few steps here and there in aggregate make a big difference.
Yeah.
So I think that that's the key thing. Now, how that is deployed in an urban in a built or an urban environment, I think that's not really my area of expertise. But I'd be interested to hear what people on the webinar think. But clearly putting stairs in an accessible place, making it fun to participate in physical activity, especially ways of engaging those who are not the gym bunnies. Yes. Engaging the people who traditionally wouldn't, do those. But this isn't about those short bursts of really heavy intensity exercise. This is about continually getting up and moving around in small and brief ways. Yeah,
that kind of incidental movement. And for me, it's really about changing people's habits. So a lot of people are using buildings with habits on autopilot at the moment. So there are people that will just walk into a building and take the lift because then they're thinking about their emails and things. The last thing they're thinking about is I need to change this habit today. Yeah. So there's those things. And the same with a standing desk. I'm trying to get myself into the habit of a standing desk, but sometimes it's not the top of my priority, so I need a bit of, come on everyone, tell each other to use the standing desk and get the cultural and the habit changed of people, so it just becomes the norm that you use it for an hour or two a day. Other things that I've seen are obviously putting recycling bins not right by the desk, so at least you have to get up to put something in the bin. It feels a bit annoying at first, but again, it just makes you get up and do those things. And I went to visit, I actually went to Airbnb offices in San Francisco last year, which were incredible. I mean, you felt like you were outside half the time because of the lighting, and it's a huge living wall, and you sat outside having kind of al fresco dining, but they had different rooms for different activities. So people, to say you were working on the morning in something, you were writing something and you needed to focus, there was kind of like a writing room. So you got up and moved to different rooms based on the different activities, and I thought that was quite clever encouraging people to move. So a lot of this thinking can be considered in the very early design stages, I guess, of creating new buildings of the future. And then there's obviously things that you can do to intervention with buildings that are already built. And I appreciate you can't structurally change buildings to do some of this stuff, but there are options on both sides. Yeah, and I think it comes down to, there's lots of creative. I work with a small, and it doesn't have to apply to big companies that have lots of resources like Airbnb. It can apply to. I work with a small company up in Scotland, and they just regularly they have a team meeting that's a walking meeting, and that's every single day. They will go for half an hour to 45-minute walk, and they sort of it's a discussion point with an agenda. So it is a proper meeting with an agenda, and they discuss a whole range of things that the company needs to discuss. And I think what it comes down to is taking this stuff seriously, in the same way that one takes smoking seriously or other risk factors seriously. It's taking this seriously and thinking, what can we do within our environment and within our behaviours within our environment to modify this
this important risk factor.
Yeah. How important do you think kind of technology and data are to all of these interventions and things? Because obviously there's lots of new technologies coming out. There's loads of data we can be collecting in buildings, usage of different things.
Well, clearly it is very important, because I think the difference that technology and data make are to be able to personalize things, and to so technology, separate the two. Technology, things like having a stimulus, my smartwatch gives me a little buzz every now and again if I've been sitting down too long. Those are simple technologies, and I'm not an expert in technology, but you can see that there's a lot of potential there for making us or making the healthy thing to do, the kind of attractive thing to do, or reminding us, because we forget. And then the data is really important. I think in healthcare generally, this data thing is becoming critical. Data is the data on what our health status is, what outcomes we're achieving with the interventions, be it a drug, be it surgery, be it a lifestyle intervention, what outcome it achieves. We're only at the beginning of that process, but if we had that data, it would be, and I often make this point, that it's as clinically important so data is as clinically important an intervention as a drug or a scalpel in terms of our health. If we apply data in the right ways to identify what is giving us the best health outcome, and then modify those interventions so that it improves even further, understand our own health and well-being, and that's why there's such an impetus now on getting health data together, encouraging people to allow their electronic medical records and so on to be shared. So in the same way, getting personalized data on your activities, you can track it yourself. It helps you to personalize the messages to people. And it gives you information about things like how the building is being used and how you can improve and upgrade to an even better lifestyle intervention in the future.
Yeah, so we collect data obviously with the Step Jockey program. When we implement the stair climbing program, we get an awful lot of rich data aggregated from the users, so we can see the breakdown of demographics, of gender, and that really then helps us direct the messages for the next campaign. So if we reach a certain demographic, or for example we see that it's only people on the first to fifth floors taking part, we've not managed to engage those on the higher floors, which is fair enough if they've got to climb many more stairs, but it helps us direct that. And we found it's also helped just from a facilities management point of view. It's been interesting where they've gone, no one's using that stairwell, we need to use that stairwell and make sure that our building flow is working for us as well. So the data just provides such insight, but also shows then there's that second level of data of what actual health outcomes and how are those improving for people. I mean, the impact, it's, I always say to clients and to people that I speak to, you change that habit of taking the stairs, where you'd usually take the lift, and you change that for the rest of your life, and you do it 3-4 times a day, and you get it on autopilot. For some people, that could be life changing. That could absolutely reduce their risk of chronic diseases and things. And it's not even taking many more minutes out of their working day. No, and that's the point. That's the point about incidental exercise. It's the small things, which is why I'm pushing myself and setting myself reminders to use the standing desk, because it's something that I really, really want to just get into the habit of, and start doing. Be really interested, we'll just see reading a few things. So Terry says, great point on data, yet personalizing the experience for people. Just reading the questions. Has anyone tried a version of the Daily Mile for workplaces? And we might have to have a look of that afterwards. I guess, is there anything else, Viv? We've been talking about this whole, and we're coming up to the half an hour, and I want to just capture any other kind of insights or messages that you think are important in this overall overall topic.
No, I mean, I think I just want to reiterate this point that we're at a point in our health systems where really the emphasis needs to be on prevention and on keeping us, and not just prevention, but even when you have chronic disease, as an increasing number of us will have in the workforce, especially those over a certain age, that that the effects of those can be drastically mitigated by things like physical exercise. So the effects of diabetes and the long-term consequences of diabetes can be dramatically reduced by taking more physical activity, by improving one's diet, etc., etc. So, you know, these are really important things. They come at much lower expense than trying to waiting to fix something when it's severely broken, and that's what we're running up against in healthcare. And so I think all this is going to drip down onto being a greater pressure on, as I say, the custodians of our environment to improve our risk factor.
Yeah, and that we're seeing that. I've seen that from speaking to many property organisations where the tenants are looking at this now. They want that, they care about their employees' well-being for both, commercial reasons and also health and social reasons. But they're looking at, when they're looking for new places to work and base themselves in offices, they want, so to say, these kind of health-giving environments, yes, rather than environments that are, disadvantaged to their working population.
Yeah, and the other final point would be about data, because we can do a million and one different things to try and improve it, but unless you're tracking, you don't really know what outcome you're delivering, whether it's money well spent or money badly spent. And you can't personalize the messages that you give to people. It's all very well putting a picture of a buff dude on a wall and say, go to our gym, but if that may actually deter a lot of people. Whereas if you say, you've walked 100 steps, well done, walk 10 more, that's a personalized message that isn't threatening, you're getting it personally, and it makes a big difference. So it really does matter, and that there is evidence to show that these messages have to be based on are better if they're personalized. Yeah, absolutely. Personal for the person at the right time, at the right place. So I'm going to close up now. Thank you ever so much for everyone that's joined. Thank you, Viv. That was so insightful and very inspiring, I have to say. To close things out, I would love to carry on the conversation with any of you who wish. I am really interested in this topic personally, so I'm opening up my diary next week to just have very informal 15-minute conversations with anybody about what they want to do in their building, their vision, any insight that I can give from my experience. I'm absolutely happy to share and would love to talk to you. So I'll be sending out a link, and you can book in any time with myself. We'll close out now. We'll send this recording. Please obviously share this with your colleagues, and we really hope that you are able to join us for our next one, which will be in September. We don't want to interfere with anyone's healthy breaks of working holidays. And thank you for joining. Thank you, Terry. Thank you, David and Elizabeth. Appreciate it. And we will speak soon. Okay, have a great day, everyone. Cheers. Thanks, everyone.
Bye.